this is a rundown of what we're going to be discussing about. So barriers is basically the obstacles that we are facing when we are going to do something. So in this case, it's about surgery. So if you have any burning question or anything that probably that you need any advice, help, anything, please feel free to ask us at the end of this topic discussion and presentation. So as usual, I have my partner and my mentor, Mr. Vimal. Are you around?
Yeah.
Yes. So Mr. Vimal had a very long day today operating, and I'm sure, as you can see, he looks exhausted. So thanks for joining us, boss. Okay, and of course, myself as well. So we are part of this series that we're trying to simplify bariatric surgery for you to understand. And of course, we have our background team with us handling this webinar. Okay, so please don't go anywhere. We try to keep to time. And of course, at the end of this whole session, we will have our lucky draw at the end of this, which is quite exciting after that. So something new yesterday, I think Khairi, our Minister of Health, was speaking regarding the our situation as being the most unhealthy country in the region, Southeast Asia. And thanks to Mr. Ranjit for sending this to me. And then I actually got this message about it as well. And according to him, he says that he's obese as well, which is very surprising because I thought he was quite in good shape, you know. So I think that's a good thing, because I think that means that the Ministry of Health is going to do something more about obesity treatment. So without further ado, we find that there are a few barriers to obesity treatment. And in particular, we're talking about the barrier to surgical and what are those barriers. So of course, the first of all will be the lack of recognition of obesity being a disease. Maybe Mr. Vimal, you want to take this point?
Yeah, glad to. So we all know in Malaysia, there's a concept. Hospitals in the olden days used to be called as rumah sakit. So a lot of patients don't come until they really sakit, you know. So I think hospitals are equivalent to that. So similarly, when you look at obesity, people don't view it as a disease per se. They know it is unhealthy. They know it doesn't look nice. They know a lot of them want to get rid of it, but they can't go about doing it in the right way. But it is not declared as obesity. Now, is that statement true? So if you look at the Western countries, if you look at the WHO, I think most people know about the role WHO plays in our life, especially during this pandemic. So WHO actually classifies obesity as a disease. Okay, this has happened many years ago. But in Malaysia, obesity is not classified as a disease. Hence, if it is not classified as a disease, patients actually cannot go to hospital and say that I'm obese, please treat me, doctor. So this becomes a big barrier, because hospitals are designed to treat people who have illnesses. Okay, so this is the first barrier, and this barrier comes because there is no declaration from the Ministry of Health, Malaysia, that obesity is a disease. Now, why have they done that? Because the main reason is our government hospitals, they are flooded with a lot of patients with a lot of illnesses. So the priority is given to diseases affecting children, cancer, okay? Then a lot of trauma, motor vehicle accidents are very high in Malaysia. So priority for a lot of government hospitals given for the care of all the diseases I mentioned just now. As we know, if you pay 5 ringgit or 3 ringgit, you go to the government hospital, everything is free, isn't it? So the payment, if you compare private to government hospital, the government hospitals, the charges are very nominal. But the treatment is no different. The drugs used, the equipment used, the surgery done, all are the same. So there's a substantial healthcare cost borne by the government. And Malaysia has one of the highest percentage of the budget given towards health. Despite that, it is not sufficient. So if they were to declare obesity as a disease, they have to pour in more money to manage obesity. Unfortunately, that's where we are now. So I think that is the reason that it has not been accepted as a disease in Malaysia. More due to lack of funds than because of the actual cost.
I think you've brought in a very good point, actually. So now, when we speak about the barriers to obesity treatment, I think we can broadly put it to these four, components, to some extent, and then we will add on as we go as well. So I think taking it further, maybe we talk about the barriers in terms of patient perspective. Okay. So when we talk about patient's perspective, you can see here we've highlighted certain possible barriers that could be, okay, and probably we'll take it in detail in terms of surgical. So some of it is because of people are unaware that of the implications of obesity, because like Mr. Vimal said, so obesity is a disease, but if we haven't accepted it as a disease, then many people will find that there's an obstacle to it. So that's why when you go for surgical treatment or even you go for medical treatment from insurance, you find that it's not covered. So that's another reason, because they haven't made it as a ground for you to claim, because it's a disease process. And then again, the treatment option may not be acceptable to a lot of patients, because the first thing you go to your doctor, they might just tell you, okay, why don't you go and join a gym, exercise, and try to lose some weight and so on. So it may be in theory possible, but if you don't have the steps to take, then it's going to be a uphill battle for you. I think that's what most of you will tell us. So it's quite difficult because there's no structured program there. And then again, the way that we make it look like obesity is a person's fault, it's an individual fault. You became obese because it's your fault. You ate too much, you didn't exercise, you didn't take care of yourself. So there's always an accountability issue. So, it's your fault. So that's what a lot of people get, that feeling when they go and seek help from, especially in established medical and medical reputable doctors and so on.
This actually, sorry.
Please feel free to give your input.
This is a very important factor. A lot of patients, a lot of people, including healthcare professionals, okay, I'm talking about doctors, GPs or specialists and all that, they think obesity is a lifestyle choice. Of course, there are many like us who look at it as a disease. But there are equally large number of people who think that it's a lifestyle choice, as though it was the patient's choice to be obese. So a lot of us don't agree about that.
Yeah, I totally agree. And then there's other things also. There's some goals that I think patients who set for themselves, they want to lose like 20 kilos in 2 months, so these are all quite unrealistic, so. And the reason why is they try to compare themselves with their, their friends and someone who's attended the Biggest Loser program and stuff like that. And another thing I think personally is the cost issue. So this is where, later we will get Ranjit's perspective and point of view to help us out here. And I think our medical system, Mr. Vimal, is that only ill patients seem to get the attention. So if, you look at all the, media sources and everything, when a person is critically ill, they're in the deathbed or they are in ICU or something, then, there's a canvassing of help, attention, or they need blood and all that. Then everybody seems to be kicked into momentum. But when there's nothing so life-threatening, you feel like it's, everything is like passive, on the go, you're still all right,
Maybe it's because due to the priority of care, when the system is overloaded, so they will prioritize. So, and when there are a lot of ill patients, they will prioritize. It's not that the government hospitals, if you go to the government hospitals, the waiting time for hernia repair may be up to a year.
Yeah.
So not all of them who can go to government hospital can come to the private sector. Yeah. So in the private sector, maybe the waiting time is much, much shorter, but then you need to be having insurances, you need to be insured, or you need to be well off, or you need to be able to withdraw from your resources. So those are the barriers actually.
Okay. Now let's go to another very important barrier. Now I actually put this as the government initially, but I don't want to step on anybody's toes, so I'll put it as the system. Okay, so our medical legal system, or sorry, our medical system, the infrastructure, and so on. So again, highlighting the topmost point is again because obesity is not a disease. Maybe we want to talk about the treatment that is not covered in all hospitals. What could be the issue, Mr. Vimal, because of that?
Okay, if you look at countries which have a successful bariatric surgery program, we don't need to go to Western countries. Yeah. We take an Asian country like say Taiwan, yeah, or Thailand or Singapore. Okay, these countries have an established bariatric surgery program. They have been doing it for quite some time. The number of patients they're operating also is fairly large, especially Taiwan. So Taiwan population is almost similar to Malaysian population. Now, why is it so popular in Taiwan but not in Malaysia? Because there is a lot of government involvement. We all know if the government doesn't get involved, you and me can shout from the rooftop. Yeah. It will take a long time, if ever. But have you see, the government agrees. Kyrie says obesity is a problem, 50%, so blah, 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 blah. Yeah. But do they ever mention that surgery is available to treat obesity? I've never heard the government saying it. Yeah. Of course, there are some programs and all that you may see. So when it is not there in the mass media, people won't know. People won't pick up on it. They would have heard about it. They know these surgeries are being done in other countries, But if you go to Taiwan, you yourself were trained in Taiwan. The patient will come and say, I want this surgery. Yep. He will bring his whole family members. I want this surgery, correct?
Yes.
Because they have seen the benefit of the surgery in their own family member or friends.
Yeah. I totally agree. Because I think the way that we have structured currently in the system line in our country, when you started doing bariatric also, it was of your own interest, your own learning, your own curve, setting up the whole program and all that. And we were fortunate to at least have that awareness. And for me, when it opened up, I could go and get trained, But still, I think a big barrier to that is that there is no training available for local surgeons to develop in bariatric surgery. So that's why could be another point why we are still delaying, in that aspect, the numbers of surgeons to treat. Okay. And then another thing is because of the insurance, I think, that is not available, and financing. Again, that's a very important issue that I think we will take up after this, once we get Mr. Ranjit on. Now, in terms of physicians or the medical personnel itself, okay, if majority of you are under follow-up with your primary care physician, your GP, your doctors who are treating you for other conditions, but it's linked to obesity. Okay? Like, for example, the first episode that we had, where we spoke about the medical conditions related to obesity, like obstructive sleep apnea, infertility, diabetes, and so on. So they are happy, or they can treat you with medication, suggest you procedures, and so on. But the root cause of it, which is your obesity itself, not many of them probably will direct you to come. So that is probably one barrier itself. Because, like I mentioned, they feel that obesity is a behavioral issue. It's your fault. Okay, so this is something that we are trying to change. Okay, there's a lot of programs going on. Doctors also need to be retrained. When I was doing, medical school itself, there was no component on treatment of obesity at that time. Okay, it was just a small chapter, small mention about it, and then that's it. But now there is a much more deeper discussion on that, where your fat itself is like one endocrine organ. The fat itself is like your lungs, your cardiovascular, your heart, and so on. It's very important. And then stigma. Some patients who come in to a doctor's clinic, they don't have the appropriate chairs, the appropriate beds, the appropriate tools for them to examine this patient, because the BP cuff may be too loose or it's too tight, so you don't get a proper reading and so on. So these are all it may seem like a very small barrier, but to a patient's perspective, to your perspective, this is where you lose that trust, and the doctors also don't seem interested in taking care of you and so on. So this is a feedback that we get from patients as well. Another issue is, of course, patients not being trained. I think we highlighted that earlier. The system itself, there is no recognized training program for obesity surgery in Malaysia at the moment. So all of us have to go overseas to train. There are some of us who are training locally, but we don't have an accredited program. And again, sometimes when you look at obesity treatment, it's not just you come in today, you start a medication, and you give some tablet like that, and you can lose weight over a period of time. You got to work for it. You got to exercise. You got to have that component to change your lifestyle, and this is important. So not all doctors are patient enough to do that, because it can be very frustrating. So that's the last point here. And time management is very intensive. So that's why a lot of people will probably lose hope, because they feel that their colleagues, the doctors, are not there with them along their journey. And this is where we come in and try to help out in that way.
But the good news is,
Yeah.
over the last, I would say, 10 years in Malaysia, there have been an increasing number of surgeons who are doing these kind of procedures. Yeah. And because many of them are doing it successfully, many of the fellow clinicians, like physicians and all, are aware that these surgeries are taking place. And even in their own treatment guidelines, there is a clause for referral for surgery.
Yeah.
But we want the numbers to increase further.
I think a big plus point is the coming out of our guidelines from the Society of Endoscopic Laparoscopic Surgeons of Malaysia, SELSMA, where we actually came out with the guidelines in March, which actually, it's in the process now of being shared with the other societies, and hopefully we can get it incorporated into the other guidelines as well. So I think that will be probably a game changer as well.
Yeah, because when you go to the insurers, they will look at all this, whether the government approves this kind of surgery. I mean, allows, the recognize obesity as a disease, whether there is a society or, coming up with guidelines. Has the country got a guideline for care? Yeah. All these are seen by insurers, because there are many countries in the world where insurance covers for bariatric surgery. So eventually we will get there. It's just the process is very tiring.
Yeah. I think another barrier also is obesity stigmatization, especially now with social media. A lot of people feel that, obesity is something that they feel very left out, so they tend to go into social media, discuss with their friends, and, find options and for treatment options and so on. So I think this is another issue where they are left to themselves, and, they kind of like rule in that situation. So I hope that we can actually, by these messages going out, we can actually reach out to patients that there are options available for treatment. Not only surgery, but of course, medical options also are available. It's just that you have to be assessed individually and decide which is the right option for you. Okay. Now, in terms of psychological, Mr. Vimal, I think, if you look at the picture here, a lot of patients who are obese tend to have that feeling that everybody's looking at them, so what they actually think, and in reality, where, people actually don't really focus on them as well. So, in reality, it may not be what they perceive. And if you can see, there's a lot of issues psychological. So I think, as surgeons, we don't simply operate on everybody. We actually go through their medical conditions. In fact, their psychological conditions, refer them to a counselor or even a psychiatrist that is necessary. Could there be a barrier in terms of the psychological issues themselves, that patients feel that they, may not be ready, or, they're not prepared enough? What do you think?
Okay, a lot of people who struggle with their weight, especially those who need surgery, it's difficult for them to control what they eat. Then it's difficult for them to embark on a dieting or exercising regime, due to the fact that they are very obese. So they really physically cannot do it, so they need help. So a lot of them tend to have some psychological disorders. So eating becomes a coping mechanism, self-isolation, living in their own world, what people think of them. All this become an obsession. So much so, like this picture shows, when they're in public, they think that everybody is looking at them. So that feeds on their psychological behavior. So it makes them more negative. So they view life in a very negative manner. This is what I think. So when you suddenly there is since they have tried many things apparently and then doesn't work. So when they are offered something like surgery, and when they look around, they don't have a support group. They don't have people to talk to who have gone through similar scenarios and come out well. So they make their own conclusions. So that's how the psychological factors affect their decision making. That's why a lot of patients who come and talk to us and may not end up going through with their surgery, So this is a very important barrier. That's why in our group, our team, we also enroll the use of a psychologist to help patients modify their behavior, pre and post-op.
Yeah, I think that's very true. When you say that patients who come and they don't actually end up with surgery, I think another very important factor or barrier is, of course, the fear itself. Because, it's like taking a flight, we always think that, flying is a much more dangerous way of transportation. But in reality, driving a car, has been shown as statistically as having a much more higher risk of accidents and deaths compared to aviation industry. But still, there's a lot of people who are paranoid and they will not take a flight. So I think it's the same thing. When you already have a limiting factor like a fear in your mind that, oh, if I'm going for a surgical procedure, I might not wake up.
Especially in Penang,
Yeah.
Even crossing the road is dangerous.
Yeah.
So yeah, like you said, the flights are very safe. Statistics show that dying in an air crash is so much less if you compare to dying in a motor vehicle accident.
Yeah, I think another thing is, remember when we were training, our chief surgeons, like Dato Naidu, Dato Kanda, when they come in and they just walk in, patients will just follow with whatever they say. Or okay, this one we're going to take you in for surgery, you're going to operate and so on. But now there is so much of discussion into what we are going to do, what are the therapeutic options, the complications, a lot of discussion, which I feel we are empowering the patients more nowadays. So they know more compared to, in our time. So maybe, could it be so we are telling them too much or we're confusing them?
Yeah. This balance is often very difficult to get. You see, when I started out, like you said, it was quite easy taking consent from patients. Sometimes so much so that you just show them a consent form, they will sign it without any surgery written even.
Yeah, true.
You see, but we have gone away from all that. We have embraced progress, and now we sit down, we talk to them, we explain the details of the surgery, the process of admission, the surgery, the discharge, the follow-up, and then we discuss the complications. So I think there's a lot of information overload, which is required by law that we tell patients. But it also increases the fear because they only concentrate on the complications.
Yeah.
They sometimes don't concentrate on the benefits, So damned if you do, damned if you don't. This is the situation. So it's a very gray area.
Yeah. I would always say, if you look at this picture here, safety. So everyone who's looking at this, those who have done surgery and those who are planning to thinking about it as well, this is the amount of care that consultants like myself, Mr. Vimal, and all of us have to take into account nowadays. So as you're driving to work every day, you don't think about, am I going to reach or not, or is my tire going to puncture, or is there someone going to run across the road? We don't think about that. But in the hospital, we take every single care that we can pre-operatively. Before you come in for your surgery, we already have worked you up to almost 80-90% to make sure everything goes well. We go through the procedure, the aftercare in terms of your nutrition, in terms of your recovery after surgery, ambulating, We have our case manager, Miss Lee, to actually guide you throughout. Make sure all your, your resources in terms of your finance, in terms of your food, in terms of the dietary preparation. So everything is taken into account so well, even after surgery itself. So we have covered like almost 95% of everything. And of course, you have the little bit that is, of course, the hand of God, So I think because of that, safety is paramount, and you will never find, it's same like the aviation industry also. The reason why the accidents are so low is because there's so much of care of the cost going into making sure that a problem doesn't happen. Prevention is better than cure. And I feel that that is what we are doing for our patients nowadays as well. Okay. Now, putting an end to that, I would say that bravery is not the absence of fear, but it's the ability to overcome it. So even in terms of complications, Mr. Vimal, it's not the avoiding complications, is that if they happen or so, we are well trained in handling it. What do you have to say for that?
Yeah. So as everyone knows, complications are part and parcel of surgery. You cannot escape. It is not like changing a spark plug or changing a tire. It's like changing a tire in the middle of the highway. So that's the risk. Okay. So, but it is it is very important to find a system which suits you. So when you are talking to your clinician about surgery, you got to ask them, okay, how many cases they have done, what are their complications, So these discussions are very important. So if the discussion center, then what are the facilities available? What will they do if there is a complication? So all these things are very important. Not only talking about the cost of the surgery. Okay. So if you're going to dismiss all these other important aspects for a cheaper product, then you are taking higher risk. Yeah. Okay. So it's important to know that complications are there, but the team which is managing you have got your back. That's important.
Yeah, I think I'll echo that, Mr. Vimal, that in our system or in our practice here, we prefer or we want our patients to actually speak to us or to talk, to have a two-way communication, just like this webinar right now also. Feel free to ask any question that you may have, because in the end of the day, your health is what counts. You are making a decision based on your information that you have. So you have to be very crystal clear of what you want, what you need to do, what you want to achieve. So we can answer everything that we can. And of course, transparency, 100%, accountability. That's what we want. Okay, so I would just like to share with you all that this is the latest meta-analysis study. Okay, a meta-analysis is basically a very, very detailed research that is done based on taking papers, different studies in the literature, and coming up with a statistic to show what is the outcome or the result of that. Mr. Vimal, maybe you can say something about how a meta-analysis that I just found from the British Journal of Surgery that shows it's a 0.08% mortality rate for bariatric surgery.
Yeah. So for a person who is not medically trained, this headline may look very abstract. So what a meta-analysis means, like what you said, they compile all the studies done by almost all the top surgeons in the world. They take their results and see how many people have died due to bariatric surgery. So if you look at it, the mortality rate means the chances of you dying during the procedure, okay, is 0.08%. Now, if you don't know, what you will think, wow, you can die on a. But if you look at it, that 0.08% is like 8 in like 10,000 surgeries, That many surgery hasn't been done in Malaysia yet. Okay. Yeah. Even when you cross the road, your risk of dying may be 2 or 3%. It doesn't stop you from crossing the road, does it?
Yeah.
So that's what this meta-analysis means. So you cannot dispute this fact. Nobody in the world can dispute that bariatric surgery results in very few deaths.
Yeah, I think well said. Okay, we've covered quite a bit about the complications and what are the barriers there. Now we'll go to a very important barrier. For the next 10-15 minutes, we will speak about the costs and regarding the financial implications of going for surgery and so on. So it is a very pleasure of mine actually to introduce a friend of mine, which I just found out over this past week actually, that we actually attended the same school, secondary school in PJ, Bukit Bintang Boys Secondary School. And I'm very proud to introduce Mr. Ranjit Singh, who's the CEO of a finance company, who actually specializes in medical loans, that is Emden Capital. He is an individual who has more than 30 years experience in the finance sector. And he's a pioneer of the medical financing in Malaysia and in Asia as well. So I would like to invite Mr. Ranjit to present or to give his some information to us regarding what is medical financing and what's the implications. Ranjit.
Good evening, Mr. Vimal, Dr. Kiru.
Hi.
Many thanks for the invite. Medical financing is actually specialized financing, where we provide loans catered to specific needs. Unlike general financing, general loans, right? They give you the money, you do whatever you want to do with it. We will look at patients' need, and we will assess, see their current needs and their future needs, and we will structure a loan for them. The loan is tailor-made to suit their requirements.
Okay, that's great, Ranjit.
Yeah, sorry.
Yeah, no, I want to find out also what are the financing options that you have for medical procedures?
Okay, currently the options available when one needs to go for a medical procedure is normal cash payment that the patient self-pays or credit card. EPF account to withdrawal is an option. I never knew EPF account to withdrawal is an option until I went into medical financing myself, right? Because I think it's not been highlighted enough for people to know. Most people don't even know there's an option. And EPF actually does not appoint any agents, so there's no fee paid to do your own withdrawals, right? Patients can just go into EPF website and go and see whether they qualify for EPF withdrawals. The last option is by Emden Capital, which is medical loans.
Okay. So thank you, Ranjit. Because these medical loans, I think, is something very new. If you ask me, I think most of our viewers and everything will know about personal loan, will know about a housing loan, will know about probably car loans, a hire purchase, and so on. But medical loans, maybe you can tell us a little bit more about that, and in detail, what does Emden Capital Medical Loan stand for?
Okay. If you look at how we structure our loans on Dr. Kiru, say someone needs a bariatric loan, comes to us and says, I need financing for a bariatric surgery. We will sit with the patient and then we'll go through the whole process. Possibly, if possible, ask the patient for more information. After bariatric, the patient will definitely lose a good 30-40% of weight. That is a given, because we've seen that happening.
Yeah.
And after bariatric surgery, after the weight loss in say about 12 months or so, there'll be a lot of loose skin. The patient needs to go do a tummy tuck, right, most likely. So we plan the whole thing with the patient. We sit with the patient, we go through the whole thing, we understand the procedure as best we can. Yeah. If possible, we speak to professionals in the field like yourself and Mr. Vimal. And we plan the whole thing with the patient. And we sit through the patient and then we go through what are your options. Okay, you've got you got say a procedure is about 30,000. All right. You have got cash 10,000. Do you need a loan of 20 or do you have EPF withdrawals? Right. So we try and assist the patients because we know after bariatric, after the weight loss, there's definitely tummy tuck. So each and every medical procedure done is different. And we take time out, we sit through the whole thing with the client. For us, it's our client, for you, it's your patient. With our client, we go through and we actually it is painstakingly tailor-made to suit the client's needs. Um, we know a lot of patients when they go to banks, the financing applications get rejected for no particular reason. I mean, nothing concrete,
Yeah.
So we feel for the clients when they come back to us. We really feel for them, especially in terms of when it's needed for medical. If they need it for, let's say they want to go for holiday and all that, your loan get rejected. That's perfectly fine, lah, dog. Betul lah,
Yeah.
You know, this one they need it for medical reasons.
Right.
And bariatric is very close to my heart. And more than that, it's close to my belly. La. I used to be morbidly obese. I had a BMI of 43.
Wow.
So I know how it feels. I know how it feels to go to bed and then you have sleep apnea, you snore. My wife can't sleep at night because I snore, and difficult to find clothes and then a lot of issues. And you walk, there's a lot of discomfort. You sit, backache, the works of it, lah.
Yeah. You're right. I think the good thing is that because you were coming from there, Ranjit, so probably that's why you're quite passionate in that and you already have that. For myself, Mr. Vimal, I think because we are in that line of managing this kind of patients for more than 10, 15 years, so it's that kind of passion that gets us to do what we do and keep on doing it, because the numbers who are doing it also are very few in the country. So we can't actually leave that. We need to carry on and do. So that's why I got in touch with you.
It's amazing. Actually, it's a pandemic of sorts in the country, within the country itself.
That's true. Okay, so Ranjit, I think we'll have a few more questions for you after this.
Sure.
In terms of your product features, could you explain to us a little bit more about how is it personalized for the individual who's looking for capital this one from Emden?
Well, the client is where the client comes to us. Like I say, we sit the client down, we speak, and we want to know the whole procedure the client wants to go through. And then we look at several options. What is the best options that suits the client? And then, okay, we tailor make a product suited for that particular client, that particular procedure.
Right.
And so once that is done, then we move on. We don't just look at marketing alone per se, but we look at a solution on the whole. What best fits or suits the client's needs at that particular time.
Right. Okay. Fantastic. And if they want to contact you, Ranjit, how do they go about? Can you let us know how to contact you?
These are our contact details. They can either call me directly or call Ms. Nisha, or they can drop us an email and we'll come back to them in 24 hours or one working day.
Okay. Fantastic, Ranjit. Thank you so much for...
Can you please go back to the previous slide?
Sure.
Can I ask some questions based on this? I'm sure the audience want to look at this.
Sure.
Okay.
Mr. Vimal, your video went out for a while, I think.
Yeah. No, Okay.
Okay. Yeah.
So I have some queries here.
Yes, sir.
The loan is up to 30K.
Correct.
So I just want to know, you have many years of experience dealing with these medical loans. So in your experience, what are the type of treatment, surgery-based, that people often take loans for?
They come, it's across the board. They come from maternity, and then when they need to go for C-sections, even knee replacements, hand surgery. Sometimes it's not covered by insurance.
Mm.
Certain body parts like they have to get, it's not covered. So or they don't lack uh, yeah, they lack coverage.
How about aesthetics, Ranjit?
For aesthetics, we definitely do a lot. Aesthetics definitely not covered, like tummy tuck, liposuction,
Yeah.
um, uh, facelift, um, fillers.
These are
Uh,
procedures that are not covered by insurance, lah.
yeah, aesthetics all not covered by insurance.
So, Mr. Kiru,
Yep, yep.
maybe you want to tell the audience how much the basic cost of laparoscopic, bariatric surgery is.
Yep. So initially, I think, Mr. Vimal, when you started, I think your time was probably about a good 10 years ago and so on, where the cost for maybe a sleeve gastrectomy was anywhere between 40 to 45,000, and gastric bypass can be touching almost 50,000. Of course, became it became more acceptable. The companies also try to support the surgery by reducing the costs, by improving the packaging in terms of how much the cost will cost. And I think a couple of years ago when we started, a sleeve gastrectomy from about 40K went down to about 35,000 now. Okay, and about a gastric bypass from about 50,000 has come down to about 40,000. So this is about the price 2.5 years ago. And again, I think this is an evolving process where the cost is determined by the demand. So if there are more patients who are actually looking for the procedure, companies will support, and then we have hospital like our center, Mr. Vimal, like Gleneagles also are looking at trying to make it more affordable and so on. So the current price, in 2021, looking towards the end of the MCO and so on, the price for a sleeve gastrectomy now is 29,500 to 30,000. Okay. And the cost of a bypass from 50,000 before to 40,000, now it's come down to about 33,000. So, Mr. Vimal, from your time to now, what do you think about the price?
Yeah, I think it's directly related to the demand. The demand has gone up. So now the hospital is waking up to the fact that there is more competition. More hospitals in Penang are probably doing this procedure. So they need to be competitive. Otherwise, we are losing a lot of patients from Penang going to KL for these procedures.
Yeah.
So we are hoping that this new cost of payment scheme will improve. So if you look at it as an audience, your 30K loan can sort of pay for the surgery, with maybe a little bit extra coming from your own pocket. So I think this will make it very worthwhile, and at least you can take cost out of it. I have another question, Mr. Ranjit. Regards to, say, the patient goes in for surgery, and unfortunately, they say the cost has gone up beyond the loan amount. Say there's a minor complication or whatever, he has to extend the stay, all that. So, are they allowed to top up their loan?
The way the act works is that the client will have to come into the office to apply for financing.
Mm-hmm.
So we can plan this. That's why speaking with consultants such as yours is very, very important to know the possibilities of it. That is how we differ from other FIs and banks. We take the trouble to do that. So we try and have a buffer. We try and have a buffer whereby uh, we look at possibilities, and if need be, we disperse those funds. But it has to be pre-approved, and everything has to be done prior to surgery.
Yeah. And what is this about the free insurance coverage?
Oh, from our part, we provide free insurance. So the whatever loan, if uh, is the in the event of any of unforeseen circumstances, okay, during the duration of the loan period, right, for whatever reason, the the client has got an accident or loses his life, so that the insurance, the family will not have to bear the burden of paying the loan, you know, or the estate will not have to bear the burden of settling.
I did calculate the cost of bariatric surgery, a rough estimate, using your loan system. It comes to about 900 thereabouts, or less than 900 per month payment for a period of 36 months. So I think that is a wonderful option to patients who think that upfront large payments will cause them a lot of economic trouble.
Correct. Then we also have been like I mentioned earlier, Mr. Vimal, we are flexible in terms of structuring the loan. So when they look at us, they shouldn't compare us with the FI and say, oh, we will be stuck with this repayment, and then we can't do an early settlement. There will be penalty for early settlement. It doesn't work with us. We are not here to make life difficult. We are here to give you flexibility and make life easier for
you. In terms of the say legally, I hope I am putting it in the right way. So are you under the like Bank Negara, or
we are under the Housing and Local Government Ministry.
Okay.
So our licenses come from there.
Okay.
We've been in business for Amden has been in business for the last 17 plus years, going 18.
Okay.
Right.
Good.
Okay.
Looking forward to working with your team.
Yeah. Ranjit, I think maybe we'll take some questions here. We are from the floor. They're asking what is the lowest qualification they can. I assume is like if they want to apply for a loan, what is the lowest amount that they can apply for that you will accept?
To make it cost effective, the minimum amount is 3,000.
3,000.
We kept it at $3,000 because really the cost is the manpower involved is quite a bit. So minimum 3,000.
Okay. Another question is that what if my job does not have a persistent income? Will that affect my loan application?
Yes, unfortunately it will, because when we approve or reject a loan, there are reasons. We also have dotted line reporting to central bank, right? So if the client is not credit worthy or doesn't have a stable income, then it'll be questionable for us to actually approve the loan.
Okay, totally. Yeah, I think that's very unfortunate.
And from a risk management point of view as well, I think we wouldn't want to do it.
Yeah. Do you actually look at the secrets and all that the financial part of their the history?
We do. We look at secrets to look at the payment pattern, how the client is. But as compared to other FIs, we understand. I mean, if let's say the client misses a payment, right? It could be some incident happened. The client explains to us, and then we can consider how being an ex-banker, how this is how banks work. You are not a person, you are a number. They put you in the system, you either get approved or reject by the system.
Yeah.
There is no human interaction, there is no engagement, there is no emotions. Unfortunately, banks have taken that out of the whole equation. So imagine a robot seeing a patient, right? There won't be emotions. Now, when you see your patients, there are emotions involved. You sit down with your patients, you understand their issues, their problems, not only the medical part, but the emotional well-being is important as well.
Yeah.
So that whole equation is taken out from the whole financial system currently.
Yeah.
We want to bring that back in the whole thing.
Okay. Look forward. That's a good thing to see. Okay, Ranjit. Mr. Vimal, I've got a question from Wong Lian. It says, hi, docs. How would you decide which surgery suits a patient?
I think the last webinar, I think we covered this.
Yeah.
So basically, patient visits us. We do our initial query. We sit down, answer a list of questionnaires, discuss their medical issues, what methods they have taken to lose weight or to remain fit, like dieting and exercising, how long they have done that for. And then we do body mass, body composition analysis. Then we do a pre-operative assessment where we do an endoscopy to look at the stomach, because most procedures for bariatric are centered around the stomach. So we want to make sure the stomach is healthy before we plan surgery. Then we also do a sleep study to see whether patients have sleep apnea. Then we also assess the patient psychologically. Are they fit for surgery? Are there medical contraindications to surgery? So we do blood tests, ECG, whether they are fit for surgery. So a lot of exhaustive analysis of the patient's condition. Now, when you have all the parameters, then we sit down at the second session and look at the options available. So the most common ones, the operative one, apart from gastric balloon and saxenda and all that, is either doing a sleeve gastrectomy or a gastric bypass. As a general rule, if the patient are diabetic, then we tend to move towards doing a gastric bypass. We will counsel the patient towards a gastric bypass, because studies show that that is the best option for patients with diabetes. If the patient doesn't have diabetes, then we will look at sleeve. Of course, there are contraindications to sleeve gastrectomy. You have reflux and all that thing. So this is done at the second sitting. So we will counsel the patient. Okay, based on all your findings, this is the possible option, the best option for you. Then we will counsel the patient regarding the pros and cons, the risks, and the benefit, the progress, follow-up, and all that for that particular procedure.
Yeah.
So this is how we will decide. So it is a step-by-step analysis and counseling.
Yeah. Well said, Mr. Vimal. So Wong Lian, I hope that answered your question, but don't worry. Soon the videos that we have, session 1, simplifying bariatrics, session 2, and even today's one, we will upload it into our YouTube video as well as into our Facebook page. So it'll be there for you all to actually look at it from time to time and to actually go through and see. I will take this next question in terms of like what Mr. Vimal has just said about hypertension and diabetes. I have a question from Lee. Doctor, I'm afraid that if there is any possibility after surgery, my diabetic and hypertension not able to be controlled. Yeah. So what you mean is actually basically that you're doing a metabolic surgery to kind of like control your hypertension, bring down your weight, improve your diabetes. So this is what we call diabetic surgery or metabolic surgery. It's a very good question, because nothing in medical field is 100%, because your body is growing older as it goes, wear and tear and so on. But in terms of cure, we don't say cure in treatment of diabetes and so on. We call it remission. Okay, remission means going back to normal. So how will you know it's normal? We have a level. So if let's say your blood HbA1c level is more than 6.5, so we know that you have impaired, diabetes, impairment already is starting. And as it goes higher and higher, then you become diagnosed with diabetes, we have to put you on medication. So similarly, once you undergo surgery, once your diabetes comes down, your HbA1c goes below 6.5, goes down below 5.5, then you're considered as remission, normal. Okay, so you don't have to take diabetic medication and so on. But as you could have done surgery when you're 42 years old, when you're 43 years old. But as you grow older, because of the wear and tear, your pancreas probably will not produce insulin, diabetes can come back. Okay, but because of your surgery already being done, you're pushing back diabetes from a younger age to maybe you might get it later on. So that's a different issue. So this is to answer your question. Another question is, how long will the wound inside my body heal after surgery? So all this we have taken in our previous episodes. Please feel free to look back again. Most of the surgeries, the bypass, sleeve, within 2 to, the next day after surgery, you'll already be taking your clear fluids, liquids, and so on. We have a protocol for you to follow. where you will be back home, hopefully in the following day or the next day after surgery. And then we have a protocol to follow you up, see you after 1 week after surgery, and again after 1 month, do your blood tests and make sure you are well. Ranjit, I've got one more question here. I think everyone is quite happy that you are here to join us. If a person already has a medical issue, when they are applying for insurance, somehow their premium cost will go up. So this question is enlightening that if, let's say, they're going for surgery and they already have a medical condition like diabetes, hypertension, and so on, will that affect their loan application, and will that affect the amount that they can apply for?
It again depends on how severe the issue is. Like I said, we need to assess each case very differently. If the patient is critically ill, then the patient can't be working. A family member can apply on their behalf. So that means we will disperse the money to the family member, right? So that shouldn't be an issue. As far as the insurance is concerned, it's a debt cancellation issue. It is not a life insurance policy, or it's just to cancel that debt for that particular. It's like taking an MRTA.
Yeah.
Something like that. But imagine that for a personal loan.
Yeah. Ranjit, another thing about EPF, if let's say the wife is going for surgery, can the husband withdraw his EPF to finance the wife's medical treatment?
They are allowed to, yes. If the procedure is allowed under EPF, then yes, you can.
So actually, the spouse can take their EPF account. How about children?
Children, I think family members, yes, they can consider.
Wow, that's quite a new development, I think, because before this it was only the individual, I think, right?
It is. So they have made some progress, yes. And the best part is for the person to go and inquire on their own. Their website is quite detailed information, what procedure, etc. So they're quite good, lah.
Okay. I have a question here from Jagesh. Hi, Jagesh. She's asking, is it pay and claim? I think the EPF, I think probably we were just talking about.
EPF, the one.
Yes, EPF.
Yeah, EPF, correct.
So I think EPF is best that they speak to the hospital or to the clinic itself.
Yeah.
I what we know, like IVF, certain of them is that they only pay a minimal amount. The rest is paid directly to the clinic.
To the clinic, yep.
Yep.
Okay. Thank you. I've got a shout out here from Hiran Kaur. She likes to thank us for our detailed explanation. And I think she would like to comment that she's a medical health practitioner who works with people living with health conditions. And she's very, very appreciative of learning so much from us today and how we're explaining the complexities involved. Yes, thank you, Hiran. Nice having you on board today as well. I think we are reaching towards the end of today's session. I think it was very productive. It's a good 1 hour. We don't want to take more than the time that is necessary so that we can get, our Friday night going on as well. So again, thank you, Mr. Vimal. Thank you, Ranjit, for coming on. Really appreciate that. Our next session will be the final part of our 4-part series of simplifying bariatrics, where, to make it simple, we're just going to ask patients in sharing their conditions after surgery, the weight loss procedure, and so on. So just like what Ranjit told us today, it'll be good to hear from them themselves and how they went through the journey, right, Ranjit?
Yeah, definitely will.
Yeah. And our next session will be exactly 1 week from now, next November 19th. If you all have found this session engaging, please feel free to comment about it on our Facebook page as well. And kindly invite anyone who might need our help and so on to join in our next session as well. This is all the links that is available there. And now we go on to a very important part of today's program, that is the lucky draw. So Ranjit, don't go anywhere. We need you to spin the wheel for you to pick a lucky winner. So I'll stop sharing here. Yipe, this one is yours now.
Okay, so maybe we should invite Mr. Wima to start first, the spin.
Spin. Stop. So,
Hiran, wow, Hiran, it's a lucky day today, lah.
Lady luck.
congratulations.
Congrats. Are you still here?
Yeah.
Yeah, okay.
Yes, thank you.
Okay, great having you. Thank you for your comments as well.
Thank you.
Congratulations. Okay, Miss Lee will get in touch with you.
Yeah. So we continue with next. Maybe we invite Mr. Ranjit to start.
All right, spin. Stop.
Laifan. Hi.
I love the color red.
Your lucky color.
Yeah.
Laifan, you around?
I think yeah, she's around just but the mic is not on.
Okay, never mind. Then you get in touch with Laifan and pass her her winning vouchers.
Sure. So the last one, Mr. Kiru.
Okay, so let's spin. Okay. 1, 2, 3, stop. Jagesh. Wow. Yeah, you're very lucky lah.
I haven't claimed my previous gift also.
Yes, never mind. One shot you can collect everything.
Yeah. Thank you.
Yeah. Hey, thank you. I think I've seen you in all the episodes lah. You're actually following very well, so you will know.
Yeah,
exactly.
I never miss one also.
Very good. So thank you so much, everybody, for your for joining us this week. Coming towards the weekend. I hope you all have a very wonderful week and enjoy. Our gifts are all touch and go e-vouchers. So feel free to use them after this. Again, don't worry. It's not the end here today. If you all have any question, anything, just look us up on Facebook or social media anywhere. Email, and we will answer your questions. Thank you all. Thank you again, Mr. Ranjit, Mr. Vimal, Hiran,
Thank
and
you
everybody.
again.
Thank you.
Yes.
Thank you, Mr. Kiru. Thank you,
Have
Mr.
a good
Vimal.
weekend.